Hey everyone, welcome to the video version of the Reviving Vet Med podcast. Rudeness is one of those things we often sweep under the rug in vet medicine. We tend to write it off as just a demanding client, a stressed out veterinarian, or a busy shift where people simply forgot their manners. We tell ourselves to grow thicker skin and just get on with the job. But the truth is, those small, low level, ambiguous slights don't just roll off of us. They land heavily on a nervous system that is already stretched to its limit, and they slowly erode our well being, our job satisfaction, and ultimately patient safety. My guest today is Helen Silver-MacMahon, a registered veterinary nurse who qualified in 2000 and has spent over 2 decades working across first opinion and referral practices. Helen holds an MSc in patient safety and clinical human factors from the University of Edinburgh. She's currently undertaking her PhD at Sheffield Hallam University and is collaborating with the University of Aberdeen on groundbreaking research exploring incivility within our profession. She is a true powerhouse when it comes to advancing our understanding of human factors, performance, and team well-being. In fact, she's a proud recipient of the 2026 Royal College of Veterinary Surgeons Inspiration Award, recognizing her incredible leadership and development work across the profession. In today's episode, we talk about shifting practice culture from the ground up, and Helen is handing us the exact empirical data and frameworks we need to make that happen. We dig into the hidden anatomy of low-level rudeness and our instinct to avoid conflict and why that's actually making us sick. And importantly, how leaders can build an organizational anxiety buffer that protects both staff and patients. So let's get into it. Here's my conversation with Helen Silver-MacMahon. All right. Hi, Helen. Thank you so much for joining me today. It's great to have you on the podcast.
Hello, I'm so pleased to be here. Thank you so much for inviting me.
Oh, of course. I'm going to start by referring back to your research, which is, of course, the big reason I brought you on the podcast today. And in your research, you differentiate workplace incivility from outright aggression or harassment by noting that it is a low level, generic, and crucially ambiguous in its intent to harm. Psychologically, why is this ambiguity sometimes more draining than clear, overt conflict?
Okay, so that's a really good question. First of all, I take it back just a tiny weeny bit, in that incivility is that lower level conflict. When we're talking about incivility, we're talking about either direct incivility, which you would be very aware of if you would be in a room and it was happening, or indirect incivility, which could happen on a lower level, which you wouldn't notice. But the most important thing is when we're defining incivility, it is a lower level behaviour. So when we look at sort of levels of behaviour in psychology, it's a lower level behaviour than something like harassment or bullying. And so it's really important that we understand how to treat it, as it were, that we remember that it's not the same, and we wouldn't be suggesting the same kind of measures for intervening if we were aware it was a higher level behaviour like harassment or bullying. So that's just a really important sort of piece to get across to start off of how we define it. Why is it sort of what more psychologically draining? Well, I think the reason for that often is because our wonderful human brains like to mull things over. So very often we know that we lose a huge amount of cognitive bandwidth, of energy to trying to process what's just happened. So you might be thinking, did that person speak to me funny? Do they mean that in their email? Is that text message, are they angry with me? Why did they ignore me? Have I done something wrong? And our wonderful human brains like to try and process this and make sense of it. But whilst that's going on, we're actually finding it really hard to sort of focus, be rational, reasonable, and actually do the task in hand. So actually the research suggests from Porth and Pearson that we can lose 61% of our cognitive bandwidth when we're in this state of trying to reason. Of course, if we know that we're in conflict, we use that 61% of the bandwidth because we're in the threat state and we're directing our brain to escape and our body to escape. But it's a quicker process of understanding. We don't spend that time ruminating, thinking about whether it's happened or not. So perhaps it's a shorter process, but it can be really, really damaging to performance. And that's why it's linked to patient safety, because we know it sort of reduces our bandwidth, reduces our ability to think rationally. And that's when we make mistakes. And when we make mistakes, obviously, we can find that our patients are harmed in the process.
Oh, it's so interesting. I'm thinking through my own experiences as I'm listening to you talk. And yes, when you're navigating something that is ambiguous, meaning you can't quite put your finger on it, it's there is that rumination and that mulling over and that questioning yourself, questioning that person internally, and really trying to make sense of it. And of course, that cognitive load is going to take away from the work that we're trying to do or the other things that we're trying to focus on. And so it makes sense that other than or in comparison to a regular conflict where you're having a conversation or discussion or argument or disagreement with somebody, you know what's happening and it's taking place in the moment and there's no question about what's happening. So that makes a lot of sense. I'm wondering, how does the brain's cognitive appraisal system burn through the energy trying to decipher whether a comment was a deliberate, oh, I feel like I just read this question to you. Sorry, Helen. I'm gonna pause.
It's
See,
all
I
right.
feel like I'm already like bumbling over it. Hold on. Okay.
Oh,
Well, I
don't
think
worry.
we already covered that. So we'll erase what I just asked because you did that already. Okay. Well, that all makes sense. And I want to talk about the hierarchy of rudeness because I think this is something that we definitely experience in veterinary medicine, and your research has shown this. Your 2022 study revealed a big difference in practice power dynamics, whereby veterinary nurses reported experiencing significantly more incivility from coworkers and senior colleagues than veterinarians or veterinary surgeons did. And I'm wondering from a clinical human factors perspective, how do these imbalances restrict interprofessional communication? And what are the hidden consequences? You mentioned patient safety a moment ago. I can just imagine when a nurse feels silenced by a senior colleague's behavior, that is going to have ripple effects in the work that they're doing.
Absolutely. And I think this is something that we really need to pay attention to in the veterinary workplace, because we know that hierarchy does exist. Um, we can't ever remove hierarchy, and that's not entirely what I'm suggesting. But I think being mindful and shallowing hierarchy makes it easier for people to come to the pool of wisdom, to share their ideas freely, to learn, to grow, and to get that kind of acknowledgement. We know that when people don't feel safe to speak up, when they don't have that psychological safety, they're less likely to contribute. And we know that they sort of metaphorically take a step back away from other people. They're more guarded in their response, they're perhaps less helpful. And when that happens, it really affects the teamwork, the way that we share information. I think hierarchy does come into play. I think historically it's really interesting, the role of veterinary nurses. We've all we our remit is that we are the hands of the veterinary surgeon. I think it still says that in the Veterinary Surgeons Act, that we are directed what to do, and then we should follow that direction. And we don't have decision making power. And so that can kind of sometimes feel that we're already in that position where we can't make our own decisions. And so we can't, I think that we sometimes fall into the trap of believing that we are kind of perhaps not a profession on our own sometimes, and we don't stand up and act like that. I hope that that is something that's becoming outdated. I think more and more vets see nurses as real paraprofessionals, who have a really interesting remit that we can actually get involved, and we can add kind of clinical expertise, wisdom to how we look after patients. And certainly, I think sometimes when you get very newly qualified vets, what you then see is that actually they're asking the nurses to help and lead them. So all these things, I think, can really help to shallow the hierarchy. But I think it also has to be quite intentional that we work hard if we're a leader, or if perhaps we are a vet or senior vet, we work hard to bring everybody to the table, not just the nurses, but patient care assistants, technicians, uh, the reception team, client care. Everybody needs to feel that they can raise concerns, because otherwise, again, what we end up with is a detrimental effect on patient safety, where people perhaps stand back and think they know the answer, but they're worried that if they speak up and they're wrong, then they're going to feel silly, and then that stops them. So it all builds into how we work as teams, and it's really important that if we want to work well together, then we can hear what each other's got to say, both professionally and personally, I think.
Yeah, absolutely. As a critical care specialist, I can't do the work that I do without my nurses. And it's not just that I see them as doing the technical work that is placing catheters and drawing blood and that sort of thing. I also really rely on their eyes and ears and intuition. And I am constantly asking them, how do you think this patient is doing? What are your thoughts on this patient's pain control? What does your gut tell you about this case or whatever it is? And just like them not feeling like they can speak up or that they have anything to offer, I can also imagine that there's circumstances where a nurse sees a mistake happening and they don't say anything because they feel like it's not their place, or maybe they don't want to get in trouble or feel as if they're being combative or standing up to a veterinary surgeon or a veterinarian. So yeah, I can definitely see this. And as you said, it's not that we want to get rid of all hierarchy because again, in the emergency room, I think about a CPR, right? Somebody has to take the reins and who's, who's running the code. So we do need that a little bit. People are going to look to a person inherently for their leadership and for their decision making, especially in those emergent or urgent situations. And in the day-to-day context of veterinary practice, we want to make sure that everybody feels safe to raise concerns.
Yeah, absolutely. Totally
Yeah.
agree.
I thought that one of the most fascinating findings in your research is that the source of the rudeness dictates the type of damage that it causes. Specifically, what you found is that incivility from senior colleagues is a primary predictor of lower job satisfaction and increased turnover intention, whereas client incivility is what really seems to drive burnout. And I'm wondering, what do you think is the psychological distinction between being mistreated by an outsider, i.e., the client, versus an insider, i.e., your boss or a peer?
Mm. That's a really interesting and good question. I think so for me, I guess the most obvious reply to that is that clients go away. And so you might have multiple clients coming in and being rude to you, and that can be incredibly draining, especially if we haven't had the right training to help us understand what to do in those moments and how to approach them, and that we haven't got a whole team approach. I think when the incivility is from colleagues or co-workers, it makes you feel that it simply makes you feel like you just don't want to be there. It makes you think, actually, why am I working in this environment? What am I getting back from it? And eventually causes people to then leave. And I think that's a trend that we're seeing more often now with younger generations coming through. Certainly Gen Z, we know that they are more likely to vote with their feet, so they're better at looking after their well-being, and they're probably more likely to actually decide to move on from a job if it doesn't feel like the right job for them. And I think if you're enduring rudeness from colleagues, I think that's quite a good predictor of how long somebody's going to stay in a job. Um, we know, though, that the effects of repeated poor treatment from clients can really be incredibly draining. And I think none of us really go into the veterinary profession to make lots of money, do we? We go in because we love the job and we feel very bonded and very driven to give the best care, to look after our patients. And I think when we're criticised, when we're blamed, when we're perhaps maybe clients might vocalize the cost of things and not understand that it's appropriate cost rather than just being seen as money grabbing. I think that then causes people to really question the bigger picture of why they're doing this and why they're um, why they're drawn to this profession. And then I think that can become a bigger problem psychologically and impact mental health more, because we are inherently veterinary nurses and vets, right? That's a huge part of our identity. And when you strip that away, it can leave us feeling really vulnerable and really lost. So I think that's probably why we kind of react and respond in that way.
Yeah, it really makes sense when you put it that way. When we think about burnout and its symptoms, two of them being emotional exhaustion and cynicism, when you have clients that are being rude or you're perceiving them as not being grateful for the services that you're providing or understanding of the situation that you're in or seeing how much you're working to save their animal, it can be exhausting. It takes a real emotional toll. You can feel like you're, pushing a giant boulder uphill. And I certainly see this causing a lot of cynicism in folks too, where you do, as you stated, start to distance yourself a little bit and just not try not to care as much almost. And I think that it makes sense then that the clients would be more contributing to that sense of burnout, as opposed to colleagues. And, when we experience that from colleagues, like you said, that's our day to day. That's supposed to be our
Mhm.
safe space. We spend a
Yeah.
lot of time at work. And if we're going to work and we're experiencing incivility from certainly a senior person, especially, but anybody on the team, yeah, it's not going to make us want to go to work as much. And as you said, probably seek work elsewhere. So, it makes a lot of sense. And I think it's important for us to state that so that people recognize why they might be feeling the way they are, that there's research really to make sense of it. Both of your papers dive into this concept of emotional labor, and that's certainly something I've talked about in different contexts, including in euthanasia, for example, which is this exhausting task of suppressing how you genuinely feel. So, for example, if you are grieving after a euthanasia and then you have to go into a puppy exam and appear happy, there's emotional labor that goes into that. And when I think about incivility, when we think about feeling these negative emotions like frustration or embarrassment or hurt or whatever it is, and then having to be polite and calm and professional, especially with clients, right? Service with a smile, as I know
Yeah.
a lot of people will refer to it as. Your qualitative data has shown that veterinary staff frequently default to emotion management and almost weaponize politeness to
Mm.
survive an uncivil client interaction. I'm wondering what you perceive the long-term damage of this to be when a person is constantly absorbing rudeness
Yeah.
and responding with a smile. I want to hear your thoughts on that.
So this is a subject that I'm really, really interested in, and actually, one of the my colleagues is a somatic coach, and it's something that I became very fascinated in when I suffered a back problem that was unexplained and was very severe and limited what I could do, but actually didn't have a very obvious cause. It wasn't that I had a disc problem or anything like that. There was no obvious cause for it. And so I began to really begin to understand the effect that stress has on your body and that the long-term effects of that are really not good. And I think we're all too good at suppressing our stress and not dealing with it. We're not really taught how to manage our emotions. We don't kind of understand ourselves fundamentally. I think emotional intelligence is very low. Humans have, what is it, about 7 emotions that they can use to articulate themselves. And I think that, because of that, actually, we find it hard to talk about it and even harder to then move into self-regulation and kind of looking after ourselves. And we know that this then becomes kind of stored within the body, and depending on how in tune and listening to our nervous system we are, if we're constantly pushing down that gut feeling or not listening to how our heart feels or ignoring aches and pains and not learning ways to actually work through these things emotionally, then I know that there's science that suggests that actually this can then lead to bigger problems and eventually, we can end up feeling incredibly poorly, and it's that somatic effect of stress stored within the body that leads us to be oftentimes I think it's our body sort of screaming at us as saying you must stop, we must find a way to deal with this better. And I think that's something that often you see is that when people suppress their emotions for a long time, it kind of comes back and bites them eventually because they have stored this stress within them, and it can cause problems.
Mm. It's so interesting. Before we hit record, you and I were discussing catching up on our personal lives, and I was sharing that I had recently gone back into practice, taking on many more shifts than I typically would, and I have absolutely seen the physical ramifications of the stress that
Mm.
that has created, and not so much stress from the work, the stress of balancing that work with my family, my young daughter, and thinking about the cases. And I think we especially for those of us who stepped away from full-time practice and then go back in, we can feel like we're relearning some things. There's been moments over the last few months where I feel like I'm back in my residency again, like relearning from the criticalists that I'm working with. And all that to say, it can present itself in all sorts of different physical ways. And I think we absolutely underestimate the physical toll of suppressing those emotions and or pushing them down and not actually processing them and or allowing them to show themselves or to address them. And yeah, I think that brings us to another question that I wanted to ask you, which is when someone is rude to us, our natural survival instinct is often to want to retreat, right? To ignore, to pretend we didn't hear it, to walk away. And interestingly, in your 2022 study, your data showed that passive strategies like mitigation and conflict avoidance are the most common coping mechanisms that veterinary teams use.
Yeah.
And yet, in your most recent paper that was published in 2025, you found this dangerous paradox where avoidance was actually associated with increased emotional exhaustion, right? One of those symptoms of burnout, and can even make the target actually more likely to become uncivil themselves over time, which is fascinating. I'm wondering what your thoughts are on that, and importantly, how we can stop defaulting to that avoidance, recognizing that it is harming us in the long term.
Yeah, I think this is a really interesting point because I think you're right. Most of us just want to get on with our job. And because incivility can be insidious, it can feel like, did they say that? Did they, am I imagining that? What happened there? Then sometimes we push it under and we move on and think, actually, I'm just going to avoid that. I'll just smile through it and it'll be fine. Um, and then obviously that can cause bigger problems. For me, I think that learning to actually have difficult conversations, learning conversation structures to make it easier for people to address incivility appropriately without being incivil themselves has been something that I've seen many people who I've shared these strategies with actually begin to thrive because of them. That they suddenly have the words that they can use. They suddenly understand the feelings that they're having, the process of how it affects them. They can find ways to self-regulate, and then they can begin to communicate in a really effective way. That means that that person is given the opportunity to put what they've done right. So I think it's also important to understand that 98% of people don't go out to be incivil. They are very often perceived as incivil for a multitude of reasons. So perhaps they're really stressed, something's happened at home, perhaps their workload is inappropriate, perhaps they're just running past you in the corridor and they just need to shout something to you over their shoulder, or they may need to text you quickly and it's a curt text. The perception means that we define it as incivility. So if you feel that somebody's been incivil to you, then that's the definition of it, and we have to pay attention to that. but we have to remember that very few people actually go out to be incivil. And we have to kind of begin to understand why that might be, and what can we do actually to um, have better conversations, make people aware of how they've made us feel, give them the opportunity to say, sorry, I didn't, that's not what I meant, because that's going to be incredibly restorative. Then you can, take it off your mental scratch pad and throw it in the bin. You can just move on with your day, instead of storing all these things up and letting them, fester and then cause bigger problems in the future. So I think understanding how we can teach people how to talk about incivility rather than run away from it is incredibly beneficial to everybody. It means that we're protecting our patients, there's less possibility of patient safety incidents. We're protecting the team, and we're protecting ourselves as individuals. And I think then also the other effect of this is that we learn to have conversations because we understand ourselves. We're better at having conversations with clients as well and understanding how they might be feeling. And I think by learning about these kind of strategies, we just end up elevating our practice in every area and really helping people enjoy what they do and feeling like they have a plan. It's, we call them courageous conversations for a reason. The first time you do it, it will feel hard, but the more we make sure that we're having these courageous conversations, the more chance we have of actually creating really fabulous sort of relationships, working relationships with, and building friendships with those that we work with, rather than holding that bad feeling, that negativity, and letting that drive how we work with people or how we avoid people more often than not.
I couldn't agree more. I too do a lot of speaking and coaching around difficult conversations or courageous conversations, and I love that you brought up this notion of empathy, right? Like really having also this generosity of heart, recognizing that most people aren't going about their day with the intention of trying to hurt someone else or be rude. There are things underneath that, right? And so what is the understory there? What is the reason underneath the client's anger, which is resulting in these bursts of incivility? And same thing for our team. And I love that you brought up, are they exhausted? Are they overwhelmed? Is there something going on at home? I think too often we jump to the conclusion that this person is just mean and they don't like me or I don't like them or whatever it is. And then we walk away and leave it when indeed there's probably something underneath that. And all it takes is a bit of curiosity and some questions to better understand what might be happening and to clear up any ambiguity and misunderstanding about what might have transpired. So I really appreciate those sentiments. There is definitely a massive trend of telling veterinary professionals to simply be more resilient, right, to combat workplace stress. And certainly when I started in this space more than a decade ago, that was my primary focus was how do we help people be more resilient? How do we get people to set boundaries and practice more self-care? And your 2025 paper really came through in delivering data proving that perceived organizational support actually mediates and buffers the anxiety caused by rudeness from coworkers. And so, for the practice owners and hospital leaders listening, I'm wondering what does it look like to practically build this anxiety buffer into the daily infrastructure of veterinary practice? Meaning, what would you say to leaders and folks who are looking to create that sense of organizational support? How can they go about doing that? Just recognizing how important that it is.
So, I think one of the pieces of research that I find most interesting is the work by Tate Shanafelt. And he found in his work that 20% of resilience is individual, whereas 80% is organizational. So I think there's like exactly what you said. This get gritty, get in there, be more resilient. This kind of thing that veterinary professionals have heard for a very long time is completely obsolete in my mind. We have an opportunity to have 20% of the influence on the situation. And I think a lot of us spend a lot of time working out what we can do personally. And I know certainly before we press record, you and I were talking about sleep routines and all things like that. You know, everything you can do to develop a more perhaps a personal resilience. Understanding that actually 80% comes from organizational led resilience is game changer for me, because I think then it takes the pressure off individuals and makes leaders actually have to focus on what's the system that they're creating, what's the environment they're creating, and how can they safeguard that. For me, when I'm working with practices, helping leaders understand the kind of conversations you can have is great. I think that helping people have a framework where if they encounter incivility, this is what we expect, and starting that from induction, but also really leaning into our values and distilling down into behaviours. So I think a lot of the time what I've seen is there's sort of a trend of organizations having values. So you'll go into a organization and maybe there's a lovely picture on the wall or on the website. You notice that they have a set of values. Very often when you go into practice and you say, oh, do you know what your values are? There's very few people who can tell you exactly what those values are. And I always find that really interesting. For me, what I think is most important is spending some time distilling down what behaviors come from those values. So if I say one of my values is respect, actually, how do I show you respect? How do you show me respect? What do I need to hold this space respectfully? And actually, what are the behaviors that would damage that? And how can we set that understanding within the team to understand what our boundaries are, how we're going to show up? You know, what are the things that we need to do for each other to keep people happy? Now that sounds like it might be a bit sort of glossing over the fact, but we know that if we passed each other in the corridor and I said morning and you said nothing, or you averted your gaze, or you ignored me, then my brain is going to start thinking, why did she ignore me? What did I do? And I'm going to spend all of this energy and cognitive bandwidth trying to figure it out. If I've had done an induction with somebody and I said, you know what, actually, one of our values is respect. And it's, you know, the way that we show that is if I see you in the corridor and I say hello, then I really want you to just, if it's a smile, just acknowledge me, say hi. And that's kind of what we do here, right? That's how we create the culture. But I'd also say to somebody, but you know what? If I say good morning to you and you don't say hi or smile or acknowledge me, then I'm going to know that something might be wrong. So rather than judging you for doing that, then I'm going to find a quiet moment and I'm going to come and check in with you and ask you if you're okay. Because I know that we've set up this situation where the norm would be to say hello. And on a normal day, you would do that. So I'm going to teach myself that actually the cue for me is not to start thinking about how I've upset you. It's actually what's going on for them that's caused this change and how can I help? And by doing that, then you begin to build a culture where people are truly looking after each other, because you've kind of set the boundaries of behavior, and then you can really start building organizational resilience. It doesn't stop there. Obviously, talking about situations, we all you know love a good clinical discussion. We love a journal club. We love an M&M of the clinical stuff that's happening, good or bad. But we don't always talk about the non-clinical stuff. So actually, if we have had a really difficult client come in, can we get together and have a chat about that? What went well? What didn't go so well? What would we do next time? It doesn't have to be a long process, but the message we're giving to other people is, wow, that was really tough. Let's talk about it. Let's get in a room and just make sure nobody's feeling that they're to blame or that they did the wrong thing. And if they are feeling that they didn't know what to do, then it's an opportunity for somebody who's maybe dealt with that situation before to lend a little bit of information, share a bit of wisdom, so that that person feels like, actually, I am learning, I am growing. Next time that happens, I know what I might do. So we're kind of building that resilience from the organization of creating sort of people who are looking after each other, and we're not relying on anybody to go it alone. We're actually kind of creating that feeling that we've got people and we can sort of rely on each other. I think the last thing I'd also say is that, you know, being prepared to speak up is really important. You know, if you do see somebody who's not themselves, going to speak to them and saying, or, are you okay? You don't seem yourself today. And just gently asking them if they need any support, or if somebody's incivil to you, making sure that you check in with them and make them aware so they have the opportunity to put it right. And I think setting that as a precedent and giving people training to understand how to do that really then begins to fuel that organizational resilience, which we know is more powerful than having all of the personal resilience that you can bring. So yeah, that's hopefully that makes sense. That's where I'd start at least.
It makes perfect sense, and I'm so aligned with everything that you shared. And I've always said, values are meaningless without defining the behaviors that demonstrate them, and as you said, also the behaviors that are not aligned with those values. And it's funny when I talk to veterinary teams, and I mentioned creating, an agreement for behavior or a shared code of conduct or whatever the practice chooses to call it. They're so surprised. Like, this seems so silly. Why would we have to talk about what the norms and expectations are at work? You just show up and you do the work, and whatever. And it's for that exact reason. If there's a value of respect, what you consider to be respectful behavior might differentiate from what I would define as respectful behavior, or what does teamwork mean, or what does kindness mean. We have these values, and yet we don't really know what that actually looks like. And when we do have a shared language for what it looks like, then we can have a conversation when things deviate from that, and that is explicitly stated, and there's no confusion or questioning or ambiguity about what might be happening. So thank you for explaining all of that. I really liked in your 2025 paper that the framework that you outlined, the listen, act, support, was in the title of the paper, and then it also came at the very end. And I really appreciated that. And I'm wondering if you can share what exactly that might look like in a busy practice. I think everybody's veterinary workplace is busy. So, what would those three things look like in real time on the practice floor?
Okay, so the first one is listen, and listening is learning to listen to ourselves. So, what am I thinking? What am I feeling? How am I showing up? Am I getting angry? What do I need to do? Do I need to take some breaths? Do I need to take a moment? How can I enhance that self-awareness and that then self-regulation that can come from that? So the first one is listening to yourself. The second one is listening to those around you, hearing what they say, being really fascinated, really curious about what they have to say. Very often when we're talking, we listen to reply. We want to, it's a quick exchange. You think about a consultation, you want to find out what the problem is, and then you want to come up with a solution. And unfortunately, it's really easy to slip into that habit in normal working day with other people. So sometimes we miss the most vital bits of information. So slowing things down, listening, you know, asking curious questions, active listening, holding silence, and then we can begin to bring in some empathy, and just practice that. So that's really the listen bit. The next bit is act, and I think acting with integrity. So for me, that means that sometimes I need to say sorry. Sorry, even if it's just a misunderstanding, because some days I'm not going to be my best self, and sometimes I'm going to turn up and I might say or do things that I regret. And so I have to be able to say sorry, because I want to fix that situation quickly, and I want to teach other people to not feel afraid to own when they're not their best selves, but to share it. And the last one is act with compassion. So, have compassionate, curious, courageous conversations with people. Use things like nonviolent communication. Use frameworks to explore why people maybe are showing up the way they are on that day, and what they need, and how they can understand perhaps how they're affecting others. Because we know that there are very few truly bad people in the world who want to show up like that. There's generally something else going on for them. So acting is all about having integrity for me and having compassion, and kind of keeping myself open to the possibility that actually how I show up is going to have a massive effect. And that involves also showing up for a conversation if necessary, not running away. Because, like the research suggests, I'm definitely somebody who runs away from any sort of conflict. So it's been a bit of a learning curve for me to be able to do this too. And then support is really what we've talked about already, supporting through organisational resilience techniques, creating social contracts, rules to live by, creating support, talking about things when they don't go so right, sharing that wisdom, helping people feel psychologically safe to bring their concerns to the table, speak up when they make a mistake or when they might feel silly. We don't want them to have that sitting on their shoulder. We want them to feel that actually we've created an environment, a culture where we're learning, we're growing, we're exploring, and we're curious about what we can do to continuously improve this environment for everybody else that we work with. So yeah, listen, act, support. I love it. That's how I train now for civility. It really feels like it comes together nicely to make it more memorable for people.
It really does. And I love that it is so multifaceted. It's listening not just to others, but to ourselves as well. Like, how am I reacting? What am I bringing into this dynamic or this conversation? I also can't help but think about support in that individual who, who did that uncivil behavior or who was rude or whatever it is, that they might be in need of mental health support. That I think, and you've touched on this a few times, that we take for granted. We assume that a person's being rude and they're just a rude person. And we forget that cynicism and emotional exhaustion and so many of these symptoms of burnout will show up as that uncivil behavior where people are demonstrating incivility in the workplace and they're being rude to others. And it's not because they want to be, but it's because they feel that they are stretched too thin or that they're really struggling in some way. So I love that the support is multifaceted and could even include supporting those individuals that are probably going through something really challenging right now.
Absolutely. And I think it goes beyond people who are, I think it's any kind of performance that you weren't expecting or is not quite where you want it to be. I think it's a really good question to be curious what's going on for that person, that
Mhm.
what's the piece of the puzzle I don't know yet? How can I find that out? Because even just them being able to share that with someone is going to be so powerful. And yes, it might be that you are able to listen and that's all they need. Maybe it's that you need to signpost them to, mental health support. Maybe
Mhm.
you need to signpost them to further training. Who knows what it is, but it starts with that compassion to be able to listen to people and to
Mhm.
really truly want to help them, I think, as well.
Mhm. Yeah, one of my mantras is ABC, always be curious.
Yeah, I love
Always
that.
ask the questions. You can never go wrong by getting curious. Well, I was so happy to see that you were the recipient of an award this year, the 2026 Royal College of Veterinary Surgeons Inspiration Award for your transformative leadership and development work across our profession. And I'm so curious, looking at the state of vet medicine today, what does truly inspiring human-centered leadership look like to you? I know you live in this space, and I'm wondering, yeah, what you see everyday practitioners starting to shift in terms of practice culture and where that can move the profession.
Yeah, I think that's a good question. I think it starts with curiosity, right? I think a lot of people in leadership are kind of thrust into leadership. They're good clinically, they're perhaps not skilled for leadership, or they don't get the training that they need. And I think then that leads us into a little bit of a danger area, which I think we really need to attend to. I think the leaders that I've worked with who are most inspiring probably are people who are deeply curious, are wanting to continue to learn, to continue to understand. And that is reflected on themselves as well. So I think having a moment to actually explore, or more than a moment to explore who you are and how you show up and what your values are, then means that when you're leading, you're really leading with integrity. and you're able to lead from the heart and bring people with you. And I think that that then makes leadership really purposeful, and it means that it's easier to be transformational in that moment because you can bring people with you, because your passion will really leak out of what you do. So for me, I love seeing leaders that are really passionate, and I think that that always inspires me to be sort of curious as to how they got there or what they did. um, but yeah, I think not being afraid to admit that you don't know all the answers and you haven't, got all the solutions right now, but actually then to spend time with people and to talk to people and find out. I think that that's really, really powerful. Be present with people. I think that's always a great thing for leaders to do. I think sometimes when you become a leader, you can feel a bit distant from people. Actually really forcing yourself to go and spend time in the mix of it, doing what other people do, understanding what their real work is like, then is always helpful. And then you're able to be more compassionate towards them, and truly understand what it's like to be in their shoes, as it were. Yeah, hopefully that answers the question.
It sure does. I feel like I could talk to you for much longer, and I just love everything that you have to share. And I think this work that you're doing is so important and is going to have such a tremendously positive impact on our profession as a whole. I'm going to finish off our time together by asking you the same question that I ask all of our guests on the podcast, which is, what does the phrase reviving veterinary medicine mean to you?
Oh, what does reviving veterinary medicine mean to me? So I think too long we have accepted that people don't pay enough attention to human skills, to non-technical skills. For me, we haven't trained people to communicate, to understand themselves. We haven't taught them how to lead, and to lead things like organizational resilience. We haven't helped people to work together as teams. And for me, I think one of the key things to reviving veterinary medicine is to give people that gift to do the work that you and I both do in helping people realize that actually there's a bigger picture here, and that alongside the technical, we need to focus on the non-technical, the human elements, and really embrace that and bring that in, because I believe that we're all really passionate individuals who work in veterinary. As I said a little while ago, I don't think many of us are in it for the mega bucks, but what we are in it is to be passionate and to look after our patients and deliver excellent care. And the more skills that we can give people to thrive in that environment and really find purpose in the work that they're doing, the better. So for me, yeah, I think that's what perhaps we need to do to focus on to revive vet med. Yeah.
That's wonderful. Thank you so much, Helen. Such wonderful words spoken. And I am so appreciative of your time today and of the research that you're doing and of all of the practical tools and strategies and scripts that you shared with us today as well. So I look forward to seeing this take effect in vet medicine and this ripple effect hopefully happen in terms of changes in our workplaces. And thank you so much again for your time.
Thank you. Thanks very much.